Hi everybody, I'm Dr. Kristi Nord, and I wanted to discuss with you reasons to get the COVID vaccine. One thing that I really desperately wish would be that I could share with everyone the amount of suffering that we've seen. I really think that if you could see how much suffering we have seen in the healthcare professions due to COVID, that you would probably go get the COVID vaccine as soon as you can. We have seen not just short-term suffering during the infection, but some very long-term just ramifications, chronic headaches, chronic lung damage where you're carrying around an oxygen pack for months and months, and really profound, drastic changes in people's lifestyles, not being able to return to work because they're so chronically ill. And those are the patients that survive COVID. And knowing about patients and seeing patients in the dying process who cannot be with their families is profoundly heartbreaking. And I just truly wish that people could see the amount of suffering that we've seen, so not just short-term but also long-term. Additionally, when we're seeing patients now who've chosen to not get vaccinated and they're being hospitalized with COVID, all of them are really, truly, deeply regretful about their decision to not get the vaccine, and people have said things like, if I had only known, and they're telling their family, tell everyone you know, please go get vaccinated. I don't wish this on anyone. And a lot of my patients have questioned, well, can I just take these supplements? Can't I just take this medication? And if I do get sick, I can be treated with all of these medications or treatments that are out there. Well, when patients come in, some of them have been taking the preventative medications and are very, very sick, and we treat them with everything we possibly can safely give them to help them survive it. And a lot of young, very, very healthy people are still not surviving it. And it's just a tragedy. It's a matter of our society losing valuable members. Every life is valuable, and I want each and every one of you to live as long as possible and be a part of our community. Every single person is a very valuable part of our community, and I really want you to be as healthy as you can and live as long as you can. And I really, truly believe the way to do that right now, it's imperative to get the COVID vaccine. And a lot of people have questioned the safety of this, and is this science that's been around long enough, is this safe? And I have read in very great detail a lot of scientific studies and the deep basic science behind this, and this has been researched actually for decades, and I absolutely believe in this and that it is safe, and I do not have concerns about long-term effects of it or affecting fertility or really any other ramifications of it any more than just the achiness and tiredness that you would expect from any regular vaccine. And I want all of my family vaccinated as well, and my family is vaccinated. So, I wouldn't ask any of my patients to do something I wouldn't do for myself. And I would ask all of you to please get the vaccine if you are able to do so. So right now we're really at a crossroads of every person needs to make a decision of, are we going to get a vaccine or are we going to get COVID? It's going to happen. It's just a matter of time. And every person's going to face that decision. You may get vaccinated and get COVID, but your chances of getting very, very sick, being put in the ICU on a ventilator or dying are profoundly, drastically lowered if you've been vaccinated. So right now our choice is vaccine or COVID. And I would absolutely take the bet and place my money on the vaccine, because we know it's just going to be a little bit of mild symptoms with the vaccine, and that are treatable with over-the-counter medicines, and possibly some teeny tiny theoretical risk, which has been unproven, versus this huge risk of death even when you're extremely healthy, making your family members sick, or harming other people, very prolonged suffering. And there's actually even some research where they've looked at people who've passed away from COVID, and we even see the COVID infection in brain cells. So who's to say that people who've had COVID aren't at increased risk for Alzheimer's or Parkinson's or ALS later on? We just don't know that yet. We don't know the ramifications of this virus. So right now, everyone's got to make that choice. COVID itself or the vaccine. And that's what we've got to choose from. I absolutely choose the vaccine, and I'll choose it over and over again. And I do not want COVID in my body, and I will do everything I can to keep that from happening, or the body of my family members or my children. And I plead with my patients and my friends for the same thing. I don't want to see anyone else suffer unnecessarily when we have a way to prevent all of this suffering.